Hi there, my name's Denny and today I'm going to show you the UWA marker set. So before you get to your data capture, there's a few things you need to consider. First one is, what marker set do you want to use? So we've got the UWA marker set, but within that, there is a lower body only, there's an upper body, and then there's the full body, which of course captures everything. In order to attach our markers to our participant today, we're going to be using firstly double-sided tape on the back of the clusters, and then if you're doing a sporting movement or something where it is possible those markers might come off, you might want to consider something like vet wrap tape or good old-fashioned strapping tape. Now before the testing session, it's important to talk with your athletes about what clothing they should wear. Now ideally we'd like something such as what Shanna's wearing for us today, which is something tight-fitting and that allows us to put markers onto the skin wherever possible. Now this might change depending on athlete comfort levels, but also the kind of activity you're looking at recording. The UWA marker set is a cluster-based marker set. So whilst we still use single markers on the anatomical landmarks, it's these clusters that we're mostly interested in.
The use of clusters allows us to employ cast modelling, a technique credited to Capozzo and colleagues, where the position of critical anatomical landmarks are stored relative to the clusters during a static condition and recreated during dynamic trials. This is rather than relying on the physical markers attached to the joints the whole time. The cast technique allows us to mitigate one source of error and a component of soft tissue artifact. The soft tissue overlying the joints translating as the joint undergoes a large range of motion. The anatomical landmarks can be stored using either markers in a static condition, as we are doing today, or using a pointer for more precise anatomical landmark identification. This is the original and intended method for use with the UWA model. You can find a list of all the relevant literature in the notes provided with this video.
To help me out, volunteer and athlete, Channa. Hey Chan, ready to have some markers stuck on?
Yeah, let's do it.
Let's do it. To position our ASIS markers, going to come in front of the athlete and come down to the hip level. From there we can palpate the ASIS position, and when we find it we place the marker on top of it such that when I take my hands away, the midpoint of the marker is directly over the bony landmark.
Alternatively, you can have the athlete identify the bony landmark themselves by directing them to their iliac crest, then having them move their hand forward to find the protruding ASIS landmark. You can then come in, double check they have identified the correct location, and then place the marker. The PSIS landmarks of the pelvis are the bony ridges located between the S1 and S2 foramen. Back dimples provide a great visual identifier for these points, but still check for the bony landmark before applying the markers. Be sure to step back and assess both the ASIS and PSIS marker placements. Left and right should be reasonably level, and PSIS is often marginally superior to ASIS. When placing the thigh cluster, first identify the femur by the greater trochanter and the knee joint, then approximate the halfway point between the two. We want to place our thigh cluster as distally as possible, but without the lowest marker being affected by knee joint movement, and this is usually just distal of this mid-femur point. The cluster should also be on the most lateral aspect of the leg, which maximises visibility to the camera system and also avoids the major muscle bellies of the quadricep and hamstring, which can increase unwanted soft tissue wobble. The knee anatomical landmarks help identify the knee joint centre, and to help us find these points, we can ask the athlete to go into a half lunge position and perform several partial squats. If we palpate during this action, we can identify the knee joint between the femur and the tibia, and probably the fibular head as well, on the lateral side anyway. The femoral condyle is just superior to these points, but it is a large flat surface, so we still need to be careful with our marker placement. We consider the knee a hinge joint with a single axis of rotation, which isn't strictly true, but it isn't far off. So once you've found the femoral condyle, we need to identify this axis of rotation and place our markers so that its centre lies along this line. Finally, make sure you place knee markers with the legs straight, as the skin slides across the joints throughout knee flexion.
Okay, next up is the tibia or shank clusters.
We want to position these mid-segment, so use the ankle malleoli and the knee joint to guide you. Ideally, we'd place these markers medially on the bony tibial wall, where there's no muscle belly wobble. However, for the best visibility, and to avoid any knocking against the opposite tibia, we will often move the clusters laterally.
Next up, we have the anatomical landmarks of the ankle.
Similar to the knee, the malleoli of the ankle are largish landmarks, so some care must be taken when positioning our markers. Position the markers on the most protruding point of each malleoli, and so that if a line were drawn through the medial and lateral markers, they would represent the ankle axis of rotation. The axis of rotation, and hence the medial and lateral markers, will have some offset in most people, with the medial marker more superior than the lateral.
For the markers of the foot, we want to find the first metatarsal, which on Channa is quite easy here, it's poking up. To find that, normally we'd place the marker medially, however for athletes that might kick their marker off. We're going to shift that marker onto the top of the shoe, but still attached to that landmark.
Our second foot landmark, it's the head of metatarsal 5, is treated in a similar way. Have your athlete wiggle their toes to help you out. Or these two landmarks should coincide with the fold in the shoe if our athlete were to stand on their toes. Finally, the calcaneus. This landmark can be hard to palpate whilst wearing shoes, so try to identify the most posterior point of the foot, not of the shoe, and place the marker in the same horizontal plane as our foot markers. That completes the lower body marker set, the recommended marker set to run the UWA lower body model. This can be used standalone, or in conjunction with the upper body and limb marker sets, which we will go into now. The clavicle marker is placed in between the medial ends of the clavicle bones, on the suprasternal or jugular notch. Feel for the most superior bony surface, being careful of the soft unprotected windpipe. The sternum marker is actually placed on the flat distal aspect of the xiphoid process. With a female athlete here, I will place the marker as close as possible while not being attached to or covered by her clothes.
And turn to face the back, please. On the rear, you're going to find the C7 landmark. If you have the athlete nod their head forwards and backwards, it is the vertebra that sticks out at the neck. T10, thoracic spine number 10, you can count them out. However, a shortcut is to find the level of the sternal marker at the front, project it backwards. Now in this case, the athlete's clothes help me out here, so I'm going to place it at the base of the athlete's clothes. The acromion cluster is a unique cluster set with this stalk and the marker on top. We're going to look to place the long edge of this cluster along the acromion process. I'm going to palpate for that ledge of the acromion process and then place the cluster so the long edge aligns with that ridge.
The marker on the stalk was added to improve shoulder marker visibility during full shoulder circumduction and throwing movements, where the raised arm might occlude surface-mounted markers. The upper arm has two clusters. Firstly, there is a proximal cluster specifically for storing and reconstructing the glenohumeral joint centre. Position this cluster inferior to the deltoid muscle belly, between the triceps and the biceps muscle bellies as much as possible. The distal cluster should be positioned just proximal of the elbow, such that it doesn't move or become dislodged during elbow flexion. have the athlete perform the movement to assist you.
A forearm cluster we're going to place to mirror image the distal upper arm cluster around the elbow joint. So first we're going to supinate the arm, have the athlete flex and extend. Again, just placing that just far enough away from the joint so that it isn't affected by that soft tissue movement during the flexion and extension. And flex and extend.
The bony anatomical landmarks of the elbow are the lateral and medial epicondyles. To find these, have the athlete flex both their shoulder and elbow to 90 degrees, and then have them perform several elbow extension and flexions. Similar to the knee, we want to use the bony landmarks as a start guide, and then place our markers on the imaginary hinge axis of rotation running through the elbow. Of vital importance later on is that we capture an elbow calibration trial with the athlete in the same position as when we apply the markers, ensuring that the markers truly identify those features we place them to represent. Now, we repeat the process for the medial epicondyle. We place 2 markers on the wrist, again using the bony anatomical landmarks as our starting guide. On the wrist, we are palpating the styloid processes of the radius and the ulna. Again, have the athlete flex and extend the joint. This can help identify these points and ultimately the wrist axis of flexion and extension, which we place our markers to represent. Finally, for the upper limb, the hand, where we're going to place 3 markers. I have 2 in a semi-rigid cluster here, and I'm going to position them so that they overlay the head of the first and the third metacarpals. The third marker is offset from the others, approximately the base of the fourth metacarpal.
And finally, we have the headband. So here I've asked the athlete to put their hair up on top of their head so that the headband isn't pulled over any bulk of hair. And I'm also going to get them to help me by holding the front of the headband down while I pull it over the back. And we want the markers of the headband to be at the 4 corners of the head, front left, front right, back left, back right. We want it to be equal. And we also want the head to be in a neutral position and the headband to be parallel to the ground.
And that's it. I hope you found this video useful. Keep an eye out for the other videos in this series, the UWA model calibration and the UWA modelling guides. Please contact us if you have any questions or requests for other guide videos. Thanks for watching and see you next time.
Yeah.